Hey everyone, happy Monday. It's the first day of hospital week, and we're going to talk about some stats and meet some of the cleaning and infection prevention crews here along with our facilities today to talk about how great and safe our facilities are for you to come see us. But first, we'll kick it to Lee to talk about the stats for the day.
Yep, we're going to talk about safety a little bit today. And as far as our stats, we're over 3,300 tests as of today. And in the last 24 hours, we had 4 positives. So we had a really good trend going of 0, 1, 0, 1. And one day doesn't make a trend. I say that all the time. But hopefully the 4 is just a temporary thing. And hopefully tomorrow we'll have less. And 4 is not terrible, but it's 4 more than we need. We need people to stay safe out there like we are in the hospital. But speaking of safety, I want to talk a little bit to Darylyn Boudreau, who is our Director of Quality and Infection Prevention. Very important job. You were born for this, Darylyn, and we're so glad we got you on our team. But I wanted to ask you a little bit about the leapfrog, the A we got for patient safety. I'm still very excited about that. Everybody here is very excited about getting the A. And there's all these different parameters you have to meet to get it. There's 28 of them. Could you tell us about 1 or 2? Give me an example of something that you have to do to be able to get an A. What's a parameter?
Low infection rates would be an example. Low surgical site infection rates.
So if you had 0 surgical site infections, you're probably going to get an A, right?
Yeah.
What else? Give me another example.
Resistant organisms. You hear about MRSA
Yes.
infections and the risk of.
If you have 0, you're
those.
probably going to get an A, right?
Right.
Okay. Cool. Uh-oh, somebody's calling you. Live TV. I love it. What about that CLABSI and CAUTI? What are those? Tell us about those.
That would be urinary tract infections devices that we place in patients. Sometimes we want to do that as infrequently as possible, and if you don't get an infection,
So keep your goal to 0 and
goal 0.
we're like going to get an A.
Correct. C. diff infections would be another.
Well, that's a bad one.
Yeah, that's
You don't
correct.
want that.
Don't want
All right. So come here. You're probably going to be safe from that. That's why we get an
Absolutely
A. So
low rate of that.
super proud of that. Another thing is hand washing. So something that you guys actually monitor. And I see you got some of this. Tell me what you got
I
here.
have some tools
this
here for teaching.
globe
So
here.
hand hygiene is actually a leapfrog metric that they score us on. And so one of the tools that we use here at the hospital to teach proper hand hygiene is a glow germ. It just
Glow
simulates germs. And
Okay.
so what this does is, Lee,
So
would
you want to do something?
I want you to wash your hands properly, and we're going to make sure you do that. So let me.
First, you're going to infect me.
I am. I'm going to dirty up your hands a little
Okay.
bit, and
Oh my
and
God.
this just simulates what
That's not
germs
good.
may look like. They're invisible to the naked eye.
So this would be
But-
like coronavirus on my hands.
Could be, or
My
C.
face
diff.
is
That
itchy.
might be C. diff.
My face is itchy really bad.
Wash your
What do I
hands
do with
before
my
you
hands?
touch your face. So.
All right, so I shouldn't touch my face and I shouldn't touch other people because I've got this on there. But now you can make me wash my hands.
I
So-
am, and luckily we are in front of a sink with
All
soapy
right.
water. So
All right, so
Start with a
wet
little
my hands,
water and a
I
little bit
fuck
of
this.
soap.
How many times?
2's good enough, but I know you
Can I
like
go
to go.
3,
Absolutely,
4,
absolutely.
5? All right.
All right, so you want to start with friction, palms of your
Friction.
hands, a lot of friction for
All right.
20 seconds.
20 seconds.
Yes.
Oh my God.
Through the backs of your hands and the webs of your fingers, Lee.
Try not to get my the backs of my hands, the
Webs
the
of your
webs
fingers.
of my fingers. I've seen you doing
Yes,
this.
your thumbs
My thumbs.
and your fingertips.
I gotta-
Most important, your fingertips.
Get out of your
That's where the
fingernails.
germs like to live.
Don't be a germ spreader.
20
Sing
seconds
your
is a
favorite
long
song.
time.
I believe we will win. All right.
All right,
So pick a
let's-
song. Has that been 20 seconds?
I
Feels like
believe
it's been
so.
40 minutes. All right. All right. Now, you know the problem with this, right? This is live, so if I still got some of that germ on me, it's going to be bad. So, did it look like I did it right?
Get your paper towel. Everything is touchless.
All right. The moment of truth.
All right, let's see how you did.
Oh, thank God. I'm safe.
There you go.
Woo!
You got
Can
an
I touch
A.
my face now?
Absolutely.
Speaking of safe, so that's great, yeah. I really appreciate what you guys do. So many things. Watching this. Tell us about this little doodad here. What do you do with that?
So another tool that we use here in the health system to make sure our environment, and we can test hands for cleanliness as well, is this little instrument. It's called an ATP monitor.
Okay.
And looks very high tech, but it's very easy. This swab, we will swab surfaces, and I won't do it right now, but you just swab a surface and then you place it inside
And it tells you if they're clean or
And in
dirty.
about 15 seconds, it'll give you a reading that tells you if you properly cleaned and disinfected the surfaces. And our environmental services team uses this a lot to validate the cleanliness of the facility with their team members. So that's a really good tool that we use as well as an extra layer.
One more tool. Darylyn is a champion of safety, but she has some co-champions and throughout the system. And it's all the clinical areas. Our nurses are champions, but facility-wise, we also have some things. I know you're going to talk to Randall, but first, let's go back to you in the studio, Sarah, to talk to another fella here as we tell us about something that we have.
Now that we know that hand washing is number one, what about the surfaces and the areas around the facilities that are needing to be cleaned? So with us is Terrence Holland, our Director of Environmental Services, which is pretty much the housekeeping who makes sure that everything is clean and properly ready for everybody to come back and to see us. So tell us a little bit about, we have this red light behind us. How does your team train to make sure that they're properly cleaning surfaces, and what are they using? We're not germexing the surfaces here. What kind of supplies and disinfectants do we use that's kind of higher grade?
Well, anytime somebody's hired, they go through a rigorous 2-week training process until they graduate through the training manager to make sure they're following procedures. We're currently using a chemical called oxicide.
Nitrous oxide?
No, not quite, Lee. Not quite. But it's been approved by the CDC and the EPA as to kill the coronavirus. So we're good on that front.
Right, and then after they're done, they're cleaning vigorously. We have a second layer of protection that comes in right behind us.
Well, before we get to that, we also use the glow gel that she uses too. The black light room. We also use the ATP.
EVS does it also?
Yes.
So we double check?
Yes, every employee gets a random room check every week. We also use the ATP swab, and the same thing. Everybody gets at least one room random check every week. An added layer of cleaning is the UV infection light you see here. After we clean certain rooms like COVID rooms or MRSA or TB, this is placed in a room as an added layer for disinfection.
And that doesn't just clean the air, it cleans the surfaces
It's
too.
every surface in the room.
And that's why you and I aren't in there right now?
You don't want to go in there right now.
We can't put our hands in there?
No.
What if we didn't
So the
take
glass, you can look at it through the glass, but
It does not penetrate glass.
okay. But if you were in the room, it'd be bad.
Yes, it would not be good, especially on your eyes.
Exactly. So on top of that, what you're seeing behind us right here with the Skytron UV robot, the air that we're breathing right now, even though we're not in the room, is also being scrubbed by UV light thanks to our facilities team. As you know, Randall Cobb and his engineering capabilities along with his team. Tell us how clean the air is that we're breathing right now.
In all of the air conditioning systems at both of our hospitals and our clinics, we use pre-filters, and as Sarah said, we use the UV germicidal disinfectant. And whether you're in the cafeteria, if you're in the OR room, it is using the UV germicidal lighting all the time. And then we have the final filtration, so it captures any particulate before it goes in there. To take it a step further, we control how much outside air is diluted, make it the cleanest air possible. We control room pressure. A lot of people don't realize we control room pressure. You want to make sure in OR rooms we have positive, blow it out. But on the opposite side of what we're going through with the COVID, a lot of people ask, what do we do? Well, we make these areas negative pressure. So when you're walking down our halls, we're not blowing any infectious air out. We're not recirculating. What we do is we use our air handling systems like I explained, but we also use what we call an air scrubber. Air scrubbers are placed in rooms where the potential COVID patients are, which is far away from the public and in general patient rooms. We take the air, which goes away from our clinical staff, away from the patient, scrubs the air, and discharges to the outside safely. And so what that means in negative pressure, if you had a tissue or if you had a little smoke test and you went to the bottom of that door, it would suck it into the room, out the other side. So when you walk through, again, we're not circulating air or anything like that. It is perfectly safe.
I know one of the things I was most impressed with when we did the demonstration of how we built the negative pressure rooms was that the nurses station in our ICUs, which are kind of like this room, we're in recovery right now in surgery, but they have the patients in the sealed off rooms, then they have the nurses station they're across from them. You all were able to engineer to where the air that was coming out of the room stopped and moved back outside, and then the ladies and gentlemen that were working at the desk, they weren't having to wear the PPE 24/7 because that air was in a bubble around them, right?
That's correct. We, obviously we want to take care of our patients. They're our most important, but also our staff. And to be able to do this type of system made our staff as safe as possible to care for these patients. Like Sarah said, if the negative pressure was so strong that we were able to do that to keep our staff safe, is definitely safe for the public or anyone else coming in our facility. And it's monitored 24/7, make sure these systems are performing like they're designed.
Absolutely. So between hand washing, our supplies and cleaning mechanisms that we do, along with facilities, engineering capabilities, there should be no reason for anybody to have any fear to come into our facilities. So make those appointments, schedule your surgeries, and come see us because we're safe. If you have, no fear going out to restaurants anymore, then you should have no fear going to the doctor.
Randall and Terrence and Daryl and all the rest of the team here is keeping people safe. And I would say, Randall, that the air in the hospital is probably safer than the air in most people's homes. Would you agree with that?
That is correct. Most homes and most businesses have one pre-filter. Most of them do not have the UV.
I wish everybody could just come stay here.
Yes.
And live here, but
Come
they
on.
can't. Anyway. All right, well, that's a wrap.
That's a wrap.
Stay singing ever safe and singing ever strong. And we'll see you next time. Appreciate it.